Hi, Cam followers. It's lovely to see you this evening. And I'm really excited to be hosting tonight's live with the wonderful Giliola. She is joining us all the way from Italy. And bless her, she's been busy today at work. So we are so grateful for your time today and really looking forward to hearing some of the the case that you have to share with us later. But first, I have to say thank you and a big shout out to Big Barker. They are our main sponsor for CAM, and we're a volunteer-led organisation. So thank you to Big Barker. And now we will crack on with the exciting stuff. So Giliola, I'll pass over to you to sort of tell our CAM family a little bit about you and how you got to be doing what you're doing now, if that's okay. And then we'll go from there.
Okay, so I'm a European specialist in diagnostic imaging, so basically I'm a radiologist, and particularly I'm focused in radiograph and ultrasound. I've been traveling 10 years for getting my degree and had some experience several US and UK and European facility. And then I decided to go back. And in Italy, physiotherapy for dogs is a very high and specialistic area. And one of the most important physiotherapists live very close by where I live. So she phoned me the first time telling me, can you do an ultrasound for me? Because I have a dog, he's in pain. I'm not sure that I really have understand what is happening. And I said, I can do it, but there is no book, nothing. So I can just pretend to give you anatomy, but don't ask me to understand what I'm looking at, because I'm talking about 2008 and there was just nothing. So I started and it was fun and nice, but I don't know. And because of that, I started really to study, and you can only study humans and horses, where this topic were already developed. And I have actually myself a muscular disease, so my rheumatologist every 3 months usually check my muscle. So I start to check. He's one of my best friend now, and it's amazing how much ultrasound is correlated with the pain receptor and the histology. So it's just one tool, it's not the only one, but this is why I became more and more fascinated about this topic. And I'm working with physiotherapists, orthopedic, and also physicists to understand what is happening. And I think now, really, finally, after 13 years,
that's a long time.
In some of my patients, ultrasound can do the difference. And I'm showing you one of these cases where, it's a long story, a lot of try to understand what is going on. And then you just need to look the patient in a different perspective, and you might find the diagnosis, but cure the patient. That is the most important. So this is the long story why now I'm really interested and invested in this topic.
Yeah, it's brilliant. And we're going to dig deeper into sort of how to diagnose a difficult case, and you've got one for us to share with us. So I'm really looking forward to that. So I don't know whether you want to have a go at getting your presentation up, and we can see if the system is going to let us share it. And then feel free, guys, as you're watching, if you do have a question or anything like that. Giliola's been really kind and said that I just need to butt in with questions whenever appropriate. If not, then I might just leave them to the end if they're not sort of with the topic. But I definitely will make sure that I go through and make sure that everyone gets an answer, even if it is after the event. I'll catch up with you on the comments. So do feel free to pop your comments in the comment box so that we can make this a bit more interactive.
Yeah.
So let's get this presentation up and have a go.
Okay, so now you are sharing, so I can.
So I'll press add to stream.
Yeah.
Yeah, that's working. Perfect.
Okay, great. So this is a view of Dolomite. It is not far away from where I live. And this is our patient. She is Luna. She's a border collie. She's young because she's 4 years of age, female intact. And she was a very happy dog. But then the mother of the dog handler starts to see the dog that change attitude, change way of walking. And this dog is doing agility, but what is very important, this is the dog of a 13 years old girl that is recovering from hikikomori syndrome. Basically, partly due to COVID, she closed herself in her room and she doesn't want to go out. She only interacting with other teenager, other person by internet. But
Wow.
the way that the psychologist was able to make her go out is to go and train the dog for agility. Is really a close bind between the dog handler and the dog, and you need to train in a field open. And so she followed the dog to train because she really loved it and she loved the combination of the dog. But the dog is not doing fine. And the trainer stopped the dog because she realized that it was not really able to extend caudally the right hand lip when she was walking. And because the dog was not looking fine, he decided to stop the training. But if the dog stopped the training, the girl is not going out of the room. And this has been going for quite a while. And the mother, she's a little bit worried about the problem. So when they bring this dog to a physical examination, that is the first step to do when you have the impression that your dog is in pain. You went to a orthopedic surgeon. He examined carefully the dog, and basically they found mild lumbar pain, and they were suspicious of a iliopsoas pain. Iliopsoas is a muscle that connects the back to the hind limb, and in sportive patient, it might be quite commonly disease. And the first step after that you do a perfect physical examination are radiograph, because maybe you can find hip dysplasia, arthrosis, or herniated disc. So you really need to rule out these diagnoses, because every diagnosis have a different treatment. But we need to do the diagnosis to be able to select the best treatment for our patient. And this is a beautiful radiograph, lateral view of the lumbar spine that for a 4 years old patient is in the normal limits. These are the hip joint that again, not too bad. What is weird is that this is a support dog. And usually you should have a lot of muscle in the thighs. If you run a lot, your muscle will be bigger. But this dog, even if she's an athlete with good result until she starts to have some problem, she has a very poor muscle. That means that she's trying to avoid to walk.
Mm.
And iliopsoas muscle, this is a drawing just superimposed on the radiograph, but is the muscle, the pink area below the bone of the lumbar spine, and this is where the muscle attach on the rear limb. So basically, is a muscle that envelop the lumbar spine and the leg, and will let you basically connect these two very important structures together. So with negative radiograph, positive clinical examination of pain in this region, we had the referring veterinarian had enough information to say this must be a iliopsoas problem. And the best way to treat this problem is with a physiotherapist. And this dog underwent a physiotherapist training and program. Of course, there were also radiograph of the stifle. The stifle is probably the most common joint that is cause of pain in very active patient. And then the other part of the leg, the tarsi, another area that really need to be checked carefully. And radiograph is fantastic. It's always the first step to do, because motion is a combination of bone and joint that we are looking perfectly with the radiograph, and then muscle and tendon, fascial system is really quite complex, but we need to check every single area. And then actually this dog had radiograph taken when he was 10 months of age, so 3 years ago, because he had a juvenile problem, was a panosteitis, that is a inflammation of the bone. But what, and these were again the radiograph when he was very young, everything was absolutely normal. What I want to point out is that the image, you can see that Luna, when he was 10 months of age, she had really big muscle surrounding the thigh. Even if at the time she was lame, the muscle is the quite white, soft tissue
Yeah, I was just going to
surrounding.
say, can you sort of point with your
Yeah,
pointer of where we're talking
no,
about?
it's not really working, unfortunately, in the
Oh, it's
stream.
not. So yeah, it's around that long bone that you can see, the top bone of the leg is the thigh region. You can see the muscles really quite markedly larger, isn't it?
Yeah, when it was 10 months, so it was still
Yeah.
a puppy, has a lot of muscle, and now he's 4 months, 4 year, is an athlete, and he has no muscle. And
Yeah.
when you have no muscle, means that you basically are not using them. And usually for a sport patient, to avoid to use muscle means that you have most likely pain. So this dog is not pretending. There is really something wrong. So with all this information, the referring veterinarian decide to send the patient to a physiotherapist, and they start instrumental therapy and hydrotherapy and massage to cure a right iliopsoas tear or strain or inflammation. And in 2 months, the dog was just perfect. She was happy, she was able to move very well. She went back to training, but 1 week after, the dog was in trouble because she was not able to extend the left hind limb. So now the right side is fine, but the left limb is showing the same sign that was showing 2 months ago.
Yeah.
So we are again with the same problem. What we should do now?
It's a good question.
Well, probably we need to do more diagnostic, because we can try to treat and be sure to treat perfectly only what we really diagnose carefully. And there is a wonderful book that is Canine Lameness, and it's very nice. It's a new book that help you to put together what to do if you have a patient that has pain in hip extension. So, first of all, it was painful only when you pull caudally the leg, or had also pain in hip adduction and flexion. So, other movement like pulling your leg laterally and up, like the picture here. Uh, this was not the case in our patient, because if was the case, hip dysplasia and osteoarthritis will be very likely. But we have already seen in the radiograph, this dog has not arthrosis and has a perfect joint. So no, we have already excluded this part, and we are not going to do more about that. Pain on lumbar sacral palpation. Yes, we have this problem. And because we have this problem, we need to rule out a neurological pathology, like if you have a little disc extrusion and radiograph is not good enough to show you hernia and the nerve, basically the dog will be in pain, especially while we'll be working, but you will not see anything really outstanding if you just use physical examination or radiograph. So you need to do, for example, MRI or CT to see better the spine. So this could be something that it was not being done in this patient, and we need to consider. Second, if you have the leg and the pain is where you extend cranially the hind limb, then stifle is most likely affected. And even if we have negative physical examination and normal stifle radiograph, the stifle is still the most important area that can get pain easily under stress. So it doesn't look like the case in this patient, but we cannot rule it out. And then you go and you palpate every single muscle. Until a few years ago, muscle were not really considered.
Yeah,
Uh,
so true.
you were looking for bone, you were looking for joint, muscle. But nowadays, especially in sportive or in age patient, we know that the muscle are really, really important. I'm going to give you an example. You spend 10 hour in a day working at your computer. How is your neck at the end of the day?
Yeah, so much. Yeah.
Okay, you go and you crying because you are such in pain. You go to your doctor and your doctor say, okay, I trust you. You are really looking in pain, so we should run some diagnostic. I touch you, yes, this is big pain. I'm going to do radiology. I'm going to do MRI. I'm going to do CT. What do you think you will find?
Yeah, it's interesting. I mean, I've done this has happened to me because I have also got a chronic pain condition.
Yeah.
And they x-rayed me and they said my neck was a little bit too straight, but they couldn't see any other issues. And then I had an MRI, and that's where they picked up the muscle inflammation in
Yeah.
one specific muscle body. So
Oh.
I don't know, is it the same? Is that the same as what you would expect?
Yeah, actually, in this specific case, this is a muscle contraction and basically is a functional disease. So
Mm,
you will not really see much, only if it's really chronic, only if you work 10 hours every day at a computer. After 2 years, you will see little changes in MRI, but basically you are extremely in pain and the diagnostic will be mostly negative.
mm,
Consider that people, this is humans, that have such severe pain, back pain, that are not able to stand. So they stay on a bed, they
mm,
go for MRI. That MRI is the best diagnostic tool for neurology, for the back, for the muscle, probably. And only in 16% of this
wow.
patient, they found the cause for pain. And the reason why is because we are looking at the wrong structure. And in the last year, first in human and now also in the vet science, we are recognizing there are some structures that are so important that really can create pain, and we need to address them and treat them. So if we have this terrible neck pain, you know what you should do? Go and have a massage. Take out the muscle contractor and free the fascial plan, that is the tissue that connect all together the muscle. However, going back to my patient, we have lumbosacral pain, and definitely we need to send this patient to a neurologist. Is the best next step. And this dog went to a specialist in neurology. He found some pain in the lumbar spine, and he suggested MRI. And MRI was performed. Well, MRI is a fantastic, quite long study. I'm only giving you two short sequence, but basically the gray structure in the center of the image in the lateral view, and the other very nice round bright structure in the cross-sectional view. These are the nerve and the spinal cord. So we are looking at what we cannot see on radiograph. We are seeing the intervertebral disc space. We are seeing the nerve that are really running nicely. We are looking at the roof of the nerve coming outside. So this is just a beautiful, normal MRI. In a dog that has a very big pain. In the structure where they did MRI, they also have a CT. Why not to perform also CT? And this is the CT of the same patient, longitudinal reconstruction and cross-section. CT show you better the bone, MRI show you better the nerve, but all together give you the best morphological aspect of what could be wrong in this patient. And you know what was the final result of MRI and CT? Absolutely normal.
Yeah.
But this patient is really in big pain. Okay, so no hip dysplasia, no neurological problem, or at least not a neurological problem that we can see. We still have possible stifle, even if it's negative in physical examination, negative in radiograph, negative in every kind of proof, but still stifle is stifle, or we could have a muscle problem. And this is when usually I receive a patient for an ultrasound. What is the beauty of ultrasound? Well, first of all, I really want to stress that I need to have a orthopedic examination first, radiograph, and often a neurologic or a physiotherapist consultation, because I need to have the patient with a localized problem, and I don't need like, I don't know what is going on, let's do an ultrasound. This is not the way how it works. But in this particular patient, we have definitely a problem, because in the 2 months that the dog was under physiotherapist, changed behaviors. She was happy, she wanted to play. Instead, now is very sad, so is very in pain. And usually, if you have a sportive patient, but this can be also related with a patient that is age has arthrosis, because in the past we were thinking, okay, this patient has elbow arthrosis. If we can cure the arthrosis, we're fine. But the problem is, because of arthrosis, the dog will change the way that it walks and will stress too much one muscle, and it will have muscle pain. And so you might treat the arthrosis, and the arthrosis can be under control, but the dog has pain because the muscle is sore. And this, for example, is a very nice study where this is just an interview. They interview 1,656 agility dog handler. So the agility dog handler, they have a special link with their animal. They really can read their pets. Most of the time, this dog handler, they understand there is something wrong. They went to the vet, and the vet performed a very good physical examination and didn't find anything. Because the thing that you have to check, there's so little, you have really to know what you are looking for. So basically, these 1,656 agility handler interview 3,801 dog. These are dogs that are playing agility, and come out that 32%, so roughly
That's
one
really
every
high.
3 patient has an injury related with sport. And 27 of these 32 patients 50% patient has more than one. And localization was shoulder, back, phalanx, and necks, but 33% were rare limb or unknown. So my dog is in pain, I don't know. And this person and this dog are followed by orthopedic, by physiotherapists. They start to do physiotherapy before training because they want to avoid long stress, tendonitis. So basically, they are healed, they're a sound dog that go to physiotherapists. That is very common. Type of lesion. So 33% of the lesion in this patient were tendon strain. Till 5 years ago, well, maybe we were considered Achilles tendon, we were considering the adductor pollicis tendon, we were considering the another 2 or 3 tendon, all the other not really interested in tendon. But this is very important. And 20% of these patients have ligament strain. The difference between a tendon and ligament, the tendon is the end of a muscle. The ligament is the band of tissue that connect two bone, and are very important for joint stability. And what is very interesting in this treatment, so this patient, this 3,801 dog, were treated with chiropractic, physiotherapy, acupuncture, no treatment, massage. Only 4% of this patient had surgery.
I can't believe as much as 15% had no treatment.
Yes. Well, basically what they do, they just stop doing sport. And because most of these problems are related to stress-induced, is chronic tendonitis because they use too much. Some parts of the body, they don't use enough other muscle. If you rest them, they're fine. The problem is you go back, and in 1 or 2 months, you're back again with the pain. Unless you change the way you train the patient. This is luckily started to be recognized. So this is what we can find in a sportive patient. And
one question that's just popped up was that survey from a specific country, or was that survey from?
Oh yes, sorry, this was survey from Canada.
Canada.
Yes.
There you go. Sorry, Julia's just asked the question.
Absolutely.
Thank you.
Pleasure. And so why I'm doing this long preface, because I need to make you understand that I'm not doing an ultrasound and looking for big lesion, big hole, because if I classify the degree of lesion, that is what I'm going to check for ultrasound. I have direct muscle injury, so a strict trauma that is like contusion, a bruise, hematoma, but you can palpate the muscle, you feel the heat and the problem, you don't need an ultrasound. Laceration, a dog bite, and you can see the muscle. So again, you don't need ultrasound. These are iridienosis, but be careful because you have functional disorder, and the functional disorder are the one that make you scream in pain with your neck if you spend 10 hours in a day looking at a computer monitor. Okay, so it's like fatigue induced. For example, you like your coach, but you decide tomorrow to go 10 hours in Alps mountain. Walking, but running. What do you think your muscle will be the next day? Horrible. This will be overextension related fatigue induced muscle soreness. And you know what I do see on ultrasound? Mostly nothing. I might see some ruptured fiber. I might see some focal area of inflammation, but would be minimal change. And again, if I have a nerve compression, and the nerve is the structure that feed the muscle. If I have not a normal nerve feeding my muscle, you will have muscle atrophy. I don't know if you have ever met a person that is not able to walk in a wheelchair, and you've checked the leg of the person. They are so small.
Yeah.
Because if the nerve is not feeding the muscle are really disappearing.
Shrink, don't they?
But,
Yeah.
exactly. But before that, they start to have pain because they don't have enough blood, they don't have enough oxygen. And again, if you go and you see this dog, in my case, they're such in pain, you put your probe and you might see some triggering point is an accumulation of acid in some area, so you will see dark spot, but really you need to look for it carefully. And you need to remember that you might have a negative ultrasound examination, but you have two very important reasons for pain in patient. And then you have the strain and the tear, where usually are so small that the orthopedic surgeon is not able to feel them. But with ultrasound, you find the hole, could be 2 millimeter, 3 millimeter in the muscle. You find the inflammation because it's very good in defining inflammation, this kind of lesion. And so you can say, okay, I do think this is a problem. So when you receive this kind of patient, you know that this is the classification of the muscle disease. You see, quite complex, but basically I need to rule out if you have a structural problem, so a hole in some muscle, or if you have a neurological or functional disorder. How you do perform ultrasound? For the rare limb, my dog is standing. And I like them standing because they are less stressed. Usually, well, now the owner cannot enter the room, but usually we ask the owner to bring some treat. And while we are doing our scan, we give some treat to the dog, and usually is very interested in what he can eat.
Yeah.
And we have to shave the leg that we want to examine because the hair will stop the ultrasound. I wore my gel, so it's like a little spa. They love it. And I have a probe, and I really gentle slide my probe, going to see the muscle. For example, this will be the patella, and then this is the quadriceps tendon. This is the femur. And then this is the rectus femoris, for example, sartorius, vasto intermedius. So these are all the muscle in the cranial aspect of the thigh of our dog. I'm looking for hole, I'm looking for white area, because white area usually are sign of inflammation, and black hole are sign of rupture. This is the normal leg, and this is in transverse. So this is a beautiful quadricep tendon. This is the femur. When it's all black is because it's the patella. I'm looking, and also I look the right side and the left side because I need to see they are the same. And then I go more proximally and I start to see the rectus femoris. You see that this is a muscle. This is the same muscle on the other side. And you see this very thin hypercoid, that means white line here. This is the fascia. Fascia is imagine like a collant that put all the muscle together and make the muscle work, because the muscle is not responsible for motion. Muscle does this, contract, but alone cannot do anything. So you need a fascia system that close this muscle and link this muscle with other muscle so that they can move together and I can move my arm and my body. So I usually pay particular attention to the fascia. They need to be very nicely defined. They need to be thin. I really need to see perfectly the fascia, especially the one between the sartorius and the rectus femoris. The sartorius is a muscle, that's a Latin name, that is particularly used for people that cross their leg a lot.
Ah, interesting.
Yeah. So again, I'm looking carefully on the right side, on the left side. I don't want to annoy you, but this is how you can see. For example,
No, it's not annoying.
the
This is
bone.
fascinating.
This is the bone. You see that ultrasound cannot see the bone. I only see the surface and I don't see anything. This is why you cannot ask for ultrasound if you don't have radiograph, because you might be a dog lame for a bone tumor, and on ultrasound you could miss it. You could have a fracture, and on ultrasound you could miss it. So before physical examination, radiograph, and then if you're looking for something little, then ultrasound can help you. And well, a particular attention to the vastus intermedius. This is the femur rectus femoris, this beautiful muscle. This is the shape of this muscle, papillon, because in sportive animal, especially in greyhound, but I've seen that also in border collie, they tend to rupture this muscle, especially if they start doing sport with cold muscle. But beautiful, perfect. You see how you can see this is one muscle, this is another one, this is another one. You can actually in transverse recognize very nicely every single different muscle.
Yeah.
Okay. We are now going to check the stifle that I told you is one of the most common area where you have pain. Ultrasound is not extremely good in checking for the cranial cruciate ligament. That is one of the the most common disease. You only can see this is a cranial cruciate ligament, this portion here, but this is where it attached to the tibia. That is the area where it never actually break here, and you cannot see these regions are because you have the bone and you have the fat, and the fat decrease your penetration and your accuracy, so you only can see the always heal part. It's not really nice, but on ultrasound you can see secondary changes, little arthrosis that you are still not see on radiograph. You can see a little bit of fusion that you are not able to spot in radiograph or on physical examination. Is really, really sensitive. But if you compare the right side that is now normal and the left side that is now disease, they are exactly the same. They're just perfect, beautiful. I'm starting to get, to be desperate because, okay, what if the ultrasound is negative and he had already CT, MRI, orthopedic examination, 2 months of physiotherapy, neurological examination, and now probably I'm going, I'm sending the dog back with negative ultrasound. I feel bad. It's not my fault, but I feel bad. While these are the area, are the tendon, this is the lateral aspect, this is the lateral meniscus with the extensor of the fifth digit, a very important tendon that is absolutely beautiful. This is longitudinal, this is cross section, this is normal. This actually is not my patient. This is just to show you how you can see abnormal. So this is the tendon. This is a fusion surrounding the tendon, and the tendon is squeezing this patient. It is extremely painful, but this is my patient. It's just perfect. So it's another disease I was hoping to find. At least I'm desperately trying to find why this dog is so in pain, but again, it's negative. This will be the meniscus again, that are either lateral or medial. This is the medial meniscus, another area that can have some problem with the collateral ligament or the stifle. Perfect.
Yeah.
Okay, now I'm sweating. I'm really stressed. But this dog was supposed to have iliopsoas problem. I still have not checked the iliopsoas. I'm now going to check another area that is very sensitive to disease, that is the attachment of the gastrocnemius. Gastrocnemius is a very big muscle that attach to the back of the stifle and run down to the tarsus. So, for example, the part of the Achilles tendon is part of the tendon of the gastrocnemius. So I look in this area and I'm looking this beautiful muscle here that I call is this one, this triangular muscle This is the flexus superficialis. I love it because it looked like the emoji for the pool.
I love it.
Yeah, it's beautiful.
I'll remember that one now.
Yeah, and it's quite common to find some problem in this region, but it's just beautiful.
Mm.
Okay, let's go. This is where the gastrocnemius attach, and we have this little bone here. Quite commonly, for example, today I have a patient that has this problem, and you see the fibula very nicely, and sometimes you have a black that means effusion, or bright that means inflammation, and this is just perfect.
Mm-hmm.
Okay, I'm happy for your dog, but now I'm really, really stressed. But we have the iliopsoas. So this dog is supposed to have iliopsoas problem. This is basically an overview of all the medial aspect of the thigh with all the muscle, with the fascial plan. I'm really, 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 now I'm the iliopsoas muscle. Basically, this is the femur. I'm going up. When the femur change shape, here is the beautiful tendon of the iliopsoas.
Wow,
I can see it very nicely. And then this is the muscle. I can check on the right and on the left. You see, I'm showing you how to do it. So this is a beautiful tendon attaches to the bone. I'm looking for a vulture, so little fragment where the tendon attach. I'm looking for, this is a normal fibrillar pattern of the tendon. I'm looking for big black hole or bright, really white area. This is the vessel, is normal. So basically, I don't see nothing.
okay.
So I spent 40 minutes feeding the dog. The dog is not eating anymore because I fed him too much. And he's happy because he enjoyed the examination. And I have nothing. What should we do?
I don't know.
Well, you know, when everything is negative, you have to start again. Go back to the physical examination. And physical examination, this is the sweetest dog ever. She is lovely. There are several ways of check the patient. I'm stressing very nicely. And now what I'm going to do in a second, I'm touching the fascia between the sartorius and the rectus femoris. I'm just very nicely.
Oh,
Wow, this is pain. Fascia is like a hair, usually are 1 millimeter thick, and is the tissue that surrounds the muscle. I'm doing the same on the other side. And why I'm touching this particular fascia? Because all the strength of the hind limb is over there. If the dog is using too much of his front portion of the leg, is like the neck 10 hours after the computer. You know, it's the sweetest dog ever.
yeah.
If he tried to bite, is because he's extremely in pain. And you see, I'm stretching, I'm doing anything, but I'm just touching very, very gentle. And this is the reaction.
Really
So
sore.
this dog has a fascial problem. Let's go back to our examination. Are we really sure that our fascia were normal? Well, I've told you that we should see very nice hair-like.
I'm glad I didn't ask at the start because I almost said, but they don't look quite the same.
Yeah, look how thickened are these one. Thickened and ill-defined. This is not totally normal. This should be like this, very, very thin, well-defined, and these are thickened. And to be honest, in my career, I'm a radiologist. So I'm not a physiotherapist. I'm not a orthopedic surgeon. I started to do ultrasound And I start to see this, I always did 2 leg because it's the best way to learn. And then every dog is different from each other. So the best part is to compare to the one side that it should be nice. And I start to see difference, and I start to touch, and I start to have pain reaction. And then I was surprised. And I have a lot of friends that are the human physiatric or physicists, and I ask them, and I say, fascia are really important. And actually, a friend of mine, she's treating me, and she said, you have a blocked fascia. I can treat that, but you will cry. Sorry, I'm not able to extend my front limb. It's like I'm really blocked. And she said, I'm going to give you a fascial massage. Basically, fascia are this little structure, really, really. I can show you a fascia in a dog. Actually, there are 5. There is a doctor that, to demonstrate what is fascia, this was a cadaver actually, and what they did, they take out the skin, they take out the muscle, and this is the most superficial fascia. It's like a collant, it's like I pretend to be a dancer, or you need to go under the water, for example, a sub suite, and is all collecting together. And sometime in this fascia that has nerve, as a pain receptor, there is lymphatic, so a lot of structure are running in the fascia. There are blockage, little connective tissue that are creating, like, stopping the flow, and this is how it's painful. And in human, they do a very deep massage. It is very painful. I did cry, but then you feel like you're born again and you can move perfectly. So basically, my tentative diagnosis in this patient is that I don't think there is a fascial problem with pain and blockage. Usually, why I do record my physical examination, because you really need to understand and check where it is the problem to properly treat it. And physiotherapists know much better than I what to do with the fascia. I know they're using instrumentation, they're using massage, is very, very important. They, for example, I also say to the owner, you are looking the TV with your dog, massage, bring color, try to move very gently, and learn how to check if your dog has a facial problem. And I did see this patient 4 months later. I sent this dog to the physiotherapist, and I said, you need to work in this fascia because I think this is a problem for this dog. And they did focus on the fascia. The dog, after 2 months, was happy again, and he went back to work, and he was working really nicely. And actually, this time, the teenager, this dog is living 400 kilometers from where I work. And the teenager with the mom came to meet me and to thank me because the dog now is very, very happy again. But what is very important, apart from the check on ultrasound, well, the fascia are not perfect. You see here, for example, there is like duplication. It is still a little bit thickened, but it's much better and much more defined than it was before. But what is very, very important is how the dog is feeling. Because again, I check my patient. I can stretch, of course, gently. I'm just trying to check if there are no other problem. I go to my fascia very gently. This time I'm pinching a little bit more, not only touching, but in pinching. Absolutely no problem.
What a difference. Yeah.
Absolutely. It's a happy dog with absolutely no problem. What is the problem? because there is a problem. Now this dog is fine, but what is the disease that make this fascia tick? What was the cause for that? Because if we don't know the cause, how we can be sure that the problem is not going back? So at the moment, we still do not know why this patient get this fascial disease. But we are more and more recognizing this as a big problem, not only in sportive patient, also in patient with chronic pain for osteoarthritis, because they have bad posture, and especially this fascia between the sartorius and the rectus femoris, a fascia between the gracilis and the semitendinosus, and the fascia in the tricep muscle are the one that most commonly create pain. So at the moment, we are in a place where we teach the owner how to recognize fascial pain, and they need to every couple months to check with the physiotherapist and do some exercise to try to make the dog work more with the back part of the limb, avoiding too much stress on the front part of the limb, because otherwise the disease of the fascia will be back. And this is the end of really happy story. And I must say, she has also won a race.
Did she? Oh, bless her. Look how gorgeous her face is. She's a beautiful dog.
Yeah, she is. And this is actually the view from my home.
Oh, wow.
And yeah, and if you're a vet, I have a site where I'm trying to create, it's still not working because I'm a little bit busy, but I'm trying to create a vet specializing in ultrasound and musculoskeletal, and in this kind of condition, changing our, experience and trying to really go deeper. I'm sure that in 5 years we will know so much more patient, more disease that we don't know. We are able now to diagnose. Better will be the quality of life of our patient.
Yeah, absolutely. And what I'll do is I'll share that link in the comment section as well, so that people can click on it. So don't worry if you haven't had time to take that down. I'll post it in the comment section so that you've got access to it.
Okay.
Thank you so much.
No, I'm going to stop sharing. I think we can finish.
There we go. I think everyone has been saying how clear and how fascinating it was, because I think a lot of, we've got so many owners on our Holly's Army forum, who've got sort of chronic pain, and sometimes it is really non-specific, just like that dog.
Yeah, absolutely.
Yeah, it's really, really tricky. And the one question that Julia Peniston asked was, in that study where the dog handlers were interviewed, was there a specific level of handler or dog performance level that was looked at, or was it just a whole cohort of people? As long as you did agility, then you could be part of the questionnaire.
They were at least in the second degree. I know every country has different degrees.
They have different levels,
but they at least have the second level. That means they at least stay for more than 6 months practicing winning, in a semi-professional level. So they were really owner that at least worked for 3 years with their dog, and they knew what they were doing. And I asked that me,
she said she was quite shocked that massage was so low in the treatment, because she said that she works with quite a lot of performance dogs, and they have massages regularly, regardless of whether they have a problem or not.
Absolutely. This is very, very important. For example, when I started in 2008, that I was looking, I was always thinking, I'm scared, but it's like imagining diagnosis instead of doing diagnostic imaging. But I was honest, I'm giving you anatomy, but because what I can see is look inside the dog without open the dog. This is what ultrasound does. And basically had some, center where there was a trainer, and I was seeing every single sportive patient of this trainer.
Mm.
After a while, I say, why all your dog developed this problem? So I discussed with a couple of physiotherapists, and I discussed with the trainer. It was fantastic, very patient about that. So, I'm ignorant, totally ignorant, but I think that maybe there is something with the way you train. It
Yeah.
changed the training.
Wow.
Every Christmas send me a card, but I never seen one of these patients.
Wow, because he just
So
decided to add in something or exercise in a different way, which built the muscle in a different way, which
exactly.
stopped.
For example, For example, in agility dog, they use too much the supraspinatus, that is the cranial aspect of the shoulder. In this dog, really make a huge difference if you do balance exercise and you made them use the triceps. This triceps does a lot of things, but counteract the stress on the supraspinatus. So if in your training try to have a very strong triceps, is very difficult that you develop in a young age problem in supraspinatus. This is the most common disease in agility dog. So really now, doing massage, doing physiotherapy when the dog is fine is the best way to avoid problem. And this is really also working a lot with osteoarthritis. More and more, I have this old patient with arthrosis, one problem there, one problem there. I think that 30% at least in my patient, I've seen usually between 400 and 500 patients for musculoskeletal sound in a year. And 30% of dogs that are diagnosed with elbow osteoarthrosis have actually acute tendonitis on the insertion of the flexor tendon.
There you go. Yeah.
Of the flexor muscle. So, and it's different if you treat arthrosis or tendonitis, are different kind of pain. So, if your treatment is working perfect, if the dog has some pain, even, some example, has always perfect with your treatment, and then pain start, might be there is some other component that need to be treatment. And really the quality of life of our patient is changing so much, and they are like 14 years old but they seems puppy when they are not in pain. It's wonderful.
Yeah, it's what makes us do our job, isn't it?
Absolutely.
Yeah, no, absolutely. Oh, Giliola, thank you so much. It was just such a fascinating, and I've got ultrasound envy because your machine has got such beautiful photos and pictures. So I might have to persuade my practice to upgrade theirs.
Well, to be honest, with a nice setting, most of the machine can have a very nice, you need a special machine if you go digit,
Yes.
carpine sometime, and, distill, because really you need to have a very high frequency transducers, like 18 megahertz probe, what is I'm using. But otherwise, for the shoulder and for the stifle and tight, if you have a good linear probe, you can do most of it.
I'm going to play with the settings now and I get back to work. Well, thank you so much. I just wanted to do a little quick plug because Hannah's been working really, really hard on the children's book, and it is available at our CAM shop. And obviously CAM, as I said before, is a volunteer-led organisation, so we really rely on the CAM shop sales and our sponsors. So I'm just going to share a little video of the book that Hannah has worked on, and it's published and it's beautiful and the illustrations are just so lovely, and it's based on her dog who she had called Holly, and it goes through a lovely story about a family that have Holly from a young age, and then her behavior starts changing, and they don't understand why. So they go to the vet, and then it's a lovely ending, but just wanted to share that with you.
Nice.
Oh, I don't know whether I've lost you. because my computer looks like it's frozen. I'm so sorry. Wi-Fi's okay. Oh, cam followers, I don't know whether you can still hear me, but my computer has completely frozen. If you can hear me, I just want to say to Giliola one more time, thank you so much for your time. We really appreciate you coming to speak to us and coming to join us again. And we will definitely be having you back because that talk was just so fascinating. So for now, goodbye, cam followers. We'll see you again next Thursday for another fabulous talk. And yeah, see you soon. All right. Bye-bye.
Bye. Bye-bye.